elbow, cubital elbow region. So in the elbow region, cubitus means, that is the Greek word, that is the elbow region, elbow joint. When we are doing semi-flexed or extension, then we are identified the one triangular area is there. Triangular area, that is a cubital fossa. Always, if you asking the question, show me the cubital fossa boundaries and content, you search at the elbow joint. There it is there, cubital fossa boundary. What are the boundaries of the cubital fossa? First, base. Base is the line which is imagine lining passing between the medial epicondyle, lateral epicondyle. You make one imagine line. Imagine line. Okay. Next, another one, lateral side, brachioradialis is there. Brachio, the muscle which is takes origin from the brachium, that is inserted at the radial side. So brachioradialis. Medial side, obliquely placed superficial compartment of the flexor compartment of the forearm muscle. There is a 5 muscles are there like this. This is a pronated teres, flexor carpi radialis, palmaris longa, flexor digitorum superficialis, flexor carpi ulnar, like this. So here the muscle which is short muscle extending from the middle epicondyle, the muscle from here to up to the where it is going to cross or coincide with the brachioradialis. Here apex is formed, here base is formed, and this side is the lateral boundary, this side is the medial boundary is there. So before going to reach in the cubital fossa, what are the structures from the roof? Skin is there. Below the skin, fascia, superfascia. That superficial fascia content, dekho, here cephalic vein is there, basilic vein, and median cubital vein is there. So now I am separating this. Okay, I am separating this. Okay, we are removed. Next, another one. We are separate. What is this tendon? Bicipital tendon. Next, here one aponeurosis is there. Dekho. See here, bicipital aponeurosis. What is that? Modification of the D fascia. Modification of the D fascia. See, this is the aponeurosis. This is the aponeurosis. It is crossing from the lateral to medial side. This is the aponeurosis, the sheet. So I told what is the importance to know this aponeurosis. It make a partition. Above this aponeurosis, venous compartment is there. Venous compartment. If you cut this aponeurosis, below arterial compartment is there. See, and now I am separating this aponeurosis. Next, what is this muscle? Brachioradialis. This is apex. This is the brachioradialis. This is the pronator teres. Pronator teres. See, clear it is. Pronator teres. This is the brachioradialis, the line which is extending from the middle epicondyle to lateral epicondyle. This make a base, This make a, what is this? Brachioradialis. This is the pronator teres. So this triangular area is known as the cubital fossa. Okay, now I am separating the muscles. First, here one vena commit. First, median nerve is there. See, this is the median nerve. See here, this is the median nerve. Median nerve. This is the brachial artery. See here, this is the brachial artery. M. B. What is this? Biceps tendon. Biceps tendon. Next, another one is the superficial division of the radial nerve. Now I am separating this muscle from here. So this is the nerve, superficial branch of radial nerve. See, these are the four contents. This is the brachial artery, biceps tendon, superficial branch of radial nerve. These are the four contents in the cubital fossa. M, median nerve. B, brachial artery. B, biceps tendon. This is superficial division of the radial nerve. So where is that deeper branch? When we are using the superficial means there is a deeper is there. So below this, it is dividing. See here, it is going deeperly. See, this is a deeper branch. See, this is a deeper branch. This I am showing here superficial branch. So deeper branch going deep to this brachioradialis. This is a brachioradialis. Next, pronator teres I am separating now. Brachial artery in the cubital fossa divides into what are the branches? Ulnar and radial. See here. See how this brachial artery divide into two. See, in the cubital fossa, superficially and deeper branch. One is the, it is going this, which side it is going? Superficial?
Radial artery.
Radial side. So this is the radial artery. This is the radial artery, which is deeper. That is the ulnar artery. Next here, what is this now? Median now. Immediately, it give a one small branch to supply to the pronator teres. This is the branch. This is a nerve to pronator teres. It cannot give any branch in the arm region. So immediately after reaching into the cubital fossa, median nerve give a small branch that is going to supply to pronator teres. Then after reaching into the forearm region, it supplies to the lateral side or medial side? Lateral half. Medial half is supplied by ulnar. Okay, here you remember this pronator teres, it having the two heads. That two heads of the pronator teres separated by the median nerve. In tomorrow dissection I can show. Otherwise, after separating this only, it is clearly visible. Pronator teres having the two heads. One head is from the medial epicondyle, another head is from the ulna. Between these two heads, the median nerve is passing. Okay. Now at this level, we are not identifying median nerve passing through the pronator teres. After separating this flexor compartment of forearm muscles, then we can identify. Okay, remember once again I will repeat. Cubital fossa, it is a triangular in shape. Base is formed by the two apex and imaginal lining. Apex, before going to apex, laterally brachioradialis, medially pronator teres. This is a pronator teres muscle. See, this is a pronator teres muscle. Where these two muscles coincide, this is form a apex, base, lateral boundary, middle boundary. Contents are mainly medial to lateral side, median nerve, brachial artery, biceps tendon. Next one, another one, superficial branch of the radial nerve. Baga. See, these are the four contents in the cubital fossa. One is the median nerve. This is the brachial artery, biceps tendon, superficial division of the radial nerve. This is very, very important viva as well as theory question also.
Sir,
Floor, at this level we won't identify the floor. When you're separating all these, then we can identify floor muscles. That is the supinator muscle is there. Brachialis muscle insertion. Roof already we are removed, no? Skin we are removed, fascia we are removed, and venous channel. So another important clinical importance at this here, median cubital vein, vena puncture, and bicipital aponeurosis importance what? It separates the compartments. Above the aponeurosis is the venous compartment, below is the arterial compartment. Mistakenly, if you are introduce this needle, if you introduce the vein, this aponeurosis preventing deeper puncture. If it is not there, what happened? Directly introduce the needle into the brachial artery. That's why that aponeurosis separate the compartments like this. Aponeurosis. Above is the venous compartment. Like this. Above is the venous compartment, below is the arterial compartment. At the same time, below, median nerve is there. If we introduce that needle into the median nerve, they punctured that nerve fibers. They lost the sensation to the flexor compartment as well as the hand. Okay? That's why we should know this aponeurosis. It is a modification of the D fascia. It is extending from the insertion of the biceps tendon. Remember this.
Can you show medial vein?
Medial
Vein.
cubital vein.
Cubital.
इस सेपरेट किए ना हम इधर.
Which one? Sir?
ये है ना.
Okay.
सेफालिक वेन.
Cephalic vein. Basic
ब्रेकियल वेन.
brachial.
ऐसा ये ऐसा.
Cephalic vein. Basilic vein.
ये बेसिलिक वेन, ये सेफालिक वेन, मीडियन क्यूबिटल वेन है बड़ा है. It connects these two veins. Okay. This is the aponeurosis which is separated. These are, if it is not there, what happens? Maybe introduce the needle into the median nerve, maybe enter into the this brachial artery.